in a very short period of time. It's incredible. It's a nightmare.
Peter, the Prime Minister's just come out of his home. Again, my condolences about your father, and I'm wishing all the best for your mother and to your whole family. Take care of yourselves. Thank you very much.
Okay, thank you. Okay, bye.
And here is the Prime Minister of Canada now.
Over the weekend, we received new shipments of essential personal protective equipment, including 4 planes worth of N95 masks. As we speak, workers are unpacking and validating these supplies so we can start shipping them to the provinces and territories as quickly as possible. These new N95 masks are in addition to the more than 820,000 that went to provinces last week. All told, this means that we have 1.1 million N95s ready to be shipped to the provinces and territories, with more to come. We have also received millions of pairs of gloves, and we'll be getting new protective gowns delivered from domestic suppliers starting next Monday. En fin de semaine,
during the weekend, we received 4 planes worth of essential goods, including N95 masks. We also have an order for Quebec. These new N95 masks can be added to the 820,000 masks that we received last week. Altogether, we are prepared to send 1.1 million N95 masks to the provinces and territories in the coming days. We also received millions of pairs of gloves, and we will be distributing those to hospitals starting on Monday. With respect to tests, we are making important progress. I'm thinking of Spartan Bioscience that is based in Ottawa, which will be supplying thousands of new test kits every month. As Dr. Tam said yesterday, more than 430,000 tests have been carried out in Canada. We will continue to increase our testing capacity and look at new technologies in order to simplify those tests right across the country.
We've also made progress on testing. Right now, we're moving forward on a range of rapid testing kits, both from here in Canada and internationally. This includes Ottawa-based Spartan Bioscience, who will soon be supplying tens of thousands of kits per month and potentially more as production increases. As Dr. Tam said yesterday, more than 430,000 Canadians have now been tested for COVID-19. Our experts and health professionals are working hard to increase our capacity to keep ramping up tests across the country. Demand for these supplies is going up, and we're going to make sure Canada can keep up.
COVID-19 has transformed the daily lives of all Canadians, but it's clear that those who are in the Arctic regions are not facing the same issues as people who live in cities. For example, I know that there are a number of people who are concerned to see empty grocery shelves. Others are worried whether their healthcare center has enough space and resources to combat the virus if it spreads into their community. I can assure you that we are doing everything we can to avoid that happening. Today, I am announcing that the government will invest almost $130 million to help northern communities fight COVID-19. Of that money, $72.6 million will be given to the Yukon, the Northwest Territories, and Nunavut to boost their health care system and help it to fight COVID-19. We are also providing funds to nutrition in the North so that food remains affordable, which will help families to remain healthy. And so that medical equipment and food can get to those regions, we're working with airline companies to make sure that that can happen. And finally, I know that a number of businesses in the North are particularly affected by this crisis. We are offering support to business owners whose expenses are not already covered through other measures we've already put in place.
I can announce that we're investing almost $130 million to support northern communities in dealing with COVID-19. If you live in the North, chances are you're worried about whether your local health center has the resources to fight COVID-19 and to cope with cases that might come up. So we're providing $72.6 million to the Yukon, the Northwest Territories, and Nunavut, specifically for healthcare and community preparedness. We're also investing more money to Nutrition North Canada. This will make it easier to afford the food and basics that keep you and your family healthy. And to ensure that things like groceries and medical equipment can continue to get to you, we're providing funding for Northern Air carriers to transport these supplies. These are tough times, but we're going to help you through them, to set your community up to come back strong when things get better. Because they will. We have to think about small businesses, too. I know entrepreneurs in the North have been hit especially hard by this crisis. If you own a business and your costs aren't already covered by other measures we've put in place, we're giving CanNor more funding to help. No matter where you live, in a small community or a big city, we're here for you. This weekend, we brought Parliament back to pass the largest economic policy since the Second World War. With the Canadian Emergency Wage Subsidy, we will protect jobs by helping businesses keep their employees on the payroll. We'll be rolling this measure out as quickly as possible. And now, as many people as we've already helped, and we're talking about millions of Canadians, we know there is more to do. You might not currently qualify for the Canada Emergency Response Benefit, but you still might need a hand. If you're a student or an essential worker, for example, this week we'll be talking about how to reach you, while also supporting sectors that have been especially hard hit. At the same time, we're working to enhance the Canada Emergency Business Account, as well as new supports on commercial rent for businesses that are hardest hit. I'll have more to say about all this soon. If you've come back to Canada from abroad, as of today, we are strengthening measures. Now, if asymptomatic travelers cannot explain a credible quarantine plan, they will be required to quarantine in a hotel. This will come into effect at midnight tonight. We are also announcing $20 million for the Canadian Food Inspection Agency to strengthen food inspections and keep our food supply safe. This will mean we can build capacity for more overtime and extra shifts for inspectors to fill demand. It also means we can invest in things like hiring and training to get more people on board. On vit des moments difficiles.
We're going through difficult times, but right across the country, I know that many people are concerned not only about their future or their health, but those of their parents and grandparents. Seniors are particularly vulnerable to COVID-19, which means that we mustn't visit them in seniors' homes or long-term care facilities. To help to protect them, we have introduced new guidelines for this type of facility. We have set clear rules with respect to restrictions on visits and controlled personnel and what to do in cases of infection. At the same time, we continue to work with the provinces and territories to ensure that they have everything they need to keep people healthy.
I want to take a moment to speak directly to everyone who's lost a loved one. If you're grieving, know that you're not alone. We are here for you, even through this incredibly tough time. And you remind us why it's so important to do everything we can to keep one another safe. We all need to do our part. We can't let up now. So to everyone, stay at home. And no matter what, stay 2 meters apart if you do have to go out. When it gets hard, let's remember that we're all in this together. Merci beaucoup. Et maintenant, prendre les questions.
I'm now ready to take your questions.
On va commencer la période de questions par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Kate Bongaro, Bloomberg. Line open.
Hello, Mr. Prime Minister. I'm wondering, what is your government's concrete plan to reopen the economy? For example, a rolling, staggered, or an all-at-once approach? And can you give us more information about these plans and your discussions with the provinces on reopening the economy?
I know that everyone is very interested to know when things are going to get back to normal, when they'll be able to go back to work, when we'll be able to leave this isolation at home, when kids will be able to go back to schools. The reality is it is going to be weeks still. We recognize that it is going to be important to get our economy going and that we will have to do it in phases. We will have to remain vigilant until such a point as a vaccine against COVID-19 is found. We are having ongoing discussions with the provinces at this point. We recognize that different regions of the country are at different places along the evolution of their COVID-19 curve. We're going to make sure that we try to stay coordinated as best as possible, but those discussions are ongoing about how we're going to reopen the economy. It's just that it's going to be a while still.
And you had just mentioned sectors.
Sorry, I just let me answer in French.
Of course, people want to know when we're going to be able to come back to normality, when they're going to be able to go back to work or go back to school. The reality is that we will have to be extremely vigilant, and in the current circumstances, that will happen for several more weeks. But at one point, we will be able, I do hope, we will be able to relax some of the measures in place. We will do that in coordination with the provinces. And we also know that different regions across the country are looking at different impacts and are at different points in their evolutionary curve. So we will remain vigilant until we have a vaccine available. So these are conversations that are continuing, but it's not going to happen right away.
Follow up, Kate?
Okay, perfect. So, and you had just mentioned about sectors who have been especially hard hit by COVID-19 and that we should be expecting news on help for them soon. And I'm wondering specifically, when is the oil industry bailout coming?
First of all, we recognize that the most important thing from the very beginning was to get help out to Canadians right across the country, regardless of the sectors they're in, regardless of their situation or their location. That's why we put forward two extremely strong measures that help all workers across the country: the Canada Emergency Response Benefit for people who've lost a paycheck, and the emergency wage subsidy, so that people can keep their jobs and be ready to come back to work when the economy comes back. As I've said a number of times, we will and we are looking at more specific sector-related relief and supports for those sectors that are hardest hit, whether it's the tourism sector, the airline sector, or the oil and gas industry or others, and we will have more to say on that shortly.
Thank you. Next question.
Thank you. Merci. La prochaine question, Raymond Fillon, TVA. À vous.
TVA. Good morning, Prime Minister. With respect to seniors' homes, I understand that is provincial jurisdiction. But other than guidelines, what can your government do to address what is happening in many of these homes and in long-term care facilities, such as the one in Montreal, Heron? Well, this is a terrible situation, and we want to express our deepest sympathies to the families who have been affected, not only there, but right across the country by these deaths in these facilities. And that's why we are saying again that people must follow public health guidelines and stay home and keep a proper distance in order to slow the spread of COVID-19. As you say, seniors' homes and long-term care facilities are within provincial jurisdiction. We have issued recommendations about this, and we will continue to work with the provinces to ensure that we're doing what we can to help them and to keep our seniors safe. We know that they are the most vulnerable people when it comes to COVID-19, and that's why at all different levels of government and all Canadians, we must do whatever we can to protect them.
We recognize the terrible and tragic stories that have come out of seniors' residences and long-term care facilities across this country, and our hearts go out to families who've lost loved ones in some terrible ways. We know we need to do more, and that is why we are highlighting how important it is, not just for ourselves, but for our loved ones, for our healthcare workers, for our seniors, that we continue to follow directions, that we stay home as much as possible, that we keep 2 meters apart wherever we can, and that we continue to wash our hands regularly. We need to make sure that our seniors who are most vulnerable to this are protected. As mentioned, seniors' residences are provincially mandated, but the federal government has put forward guidelines for across the country on making sure that our seniors are protected.
Suivi.
Un des gros problèmes dans ces centres, c'est le manque criant d'employés, de personnel.
Facilities is the lack of staff. Now, do you believe that physicians and nurses from the CAF could make a contribution? Well, we know that there are measures being taken by the provinces at this time to require that people only work in one facility, and that will help to protect people in these facilities. But they're also looking to hire other people to work in those homes and facilities to help our seniors. And we are working with the provinces to try and ensure that we can bring in the necessary people to help out.
We recognize that some of the measures taken in place to protect our seniors in our long-term care facilities, such as asking people to only work in one center instead of a few of them, will mean a need to hire more people to support our seniors and to work in those centers. And we're going to continue to work with provinces on ways to ensure that people can be found to do this important work.
Thank you. Prochaine question, modérateur.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir.
Le Devoir. Yes, good morning, Mr. Trudeau. I'd like to come back to your stay at your secondary residence at Harrington Lake. For many weeks, the authorities have been saying not to go to cottages, and there are even border controls in place between Ottawa and Gatineau. So why, in the case of your family, was it okay for you to do that? I announced last week that after 3 weeks of working here and my family being at Harrington Lake, that I would spend Easter with them, and that's what I did. But we continue to follow all the authorities' recommendations.
Mentioned last week in my presentation, after 3 weeks of my family living up at Harrington and me working here, I went to join them for Easter. We continue to follow all the instructions from public health authorities.
Merci. Question de suivi, Hélène.
Yes, but were you told that it was okay? Because this is the question that people are asking themselves on social media. Why was it okay for you? Why was it okay for you to go and see your family at the cottage? Well, my family has been living there for 3 weeks. That's where my wife and my children are at this time. And as I announced last week, I went to spend Easter with them.
Thank you. Merci. Next question, Alex Ballingal, Toronto Star. Line is open.
Morning, Prime Minister. You mentioned in your introduction that people traveling to Canada will need a credible quarantine plan. Can you expand on what the government's definition of a credible plan will be? Who will assess that? And where will that be applied at the land border as well as at airports?
The order that goes in tonight is a strengthening of the Quarantine Act orders to give authorities the ability, upon evaluation of the person entering Canada's plan to self-quarantine, if it is inadequate, they will be required to quarantine in a hotel. Examples of things that could be inadequate, for example, if their plan is to go stay in a place where there are many elderly family members at risk of COVID-19, or whether they don't have a set destination if they've been outside of the country for many years. We now have the authority to require them to self-isolate for 2 weeks in a quarantine location like a hotel.
On follow-up?
Okay. Yeah, I've noticed in the daily updates from public health, there's been incomplete information sort of stubbornly over a period of time, with case report forms on only 62% of our cases, hospitalization data for less than half. Why is this such an incomplete picture? And are you concerned that having an incomplete picture will affect or make it more difficult to allocate resources across the country?
I want to once again thank the provinces for being tremendously active on improving the quality of the data that they send us in Ottawa. There were significant gaps in the beginning, but I can highlight that almost all provinces have done a much better job in sharing their data with Canadians in their provinces, but also with the federal government, that is allowing us to have a much more complete picture. We continue to improve on data collection and collation every single day, but that is something that, as you highlight, is a really important way to ensure that we're doing the right things at the right point to keep Canadians safe.
Okay, good. Prime Minister Mike Couture with Global National. I wanted to ask you, Alberta's energy minister has said that she's expecting a federal relief package for Canada's oil and gas sector between $20 and $30 billion, and she's expecting it later this week. Can you confirm those details first, and can you say if the federal government will be taking equity stakes in Canadian firms?
When we have issues to announce on sectoral supports, we will be making those announcements, like.
So then, as a follow-up, some workers in the oil patch worry that key Canadian companies will be vulnerable to foreign takeovers or will decide to relocate head offices to other jurisdictions. Should your government forbid foreign takeovers in the energy sector or relocations for at least this period of time?
We are very concerned about the state of a number of industries across this country, including the oil and gas industry, and that's why we have worked hard on making sure that we're giving the right supports for the industry, and particularly for workers across the country. Our focus has always been on ensuring that good Canadian jobs remain. We know that Canadians and families are suffering, and that's why we need to support them. Nous reconnaissons à quel point c'est important de protéger nos industries.
Important it is to protect our industries so that we can bring the economy back in force once the pandemic is over. And we, of course, need to support the workers and industries affected by COVID-19.
Oliver with CTV National News. You said that you're going to have more news about essential workers and the CERB in the coming week, but employees at long-term care facilities are already leaving their jobs. You brought Parliament back and you passed the wage subsidy this weekend, but there was no specific help included for the long-term care industry. What specifically is your government going to do now to keep long-term care facilities properly staffed so that the new guidelines your government implemented this weekend can be followed?
We are in conversation with the provinces right now on moving forward on a model of increasing support for long-term care workers and other workers in essential industries, like Quebec has done, to ensure that people are motivated and encouraged financially, as well as because it's something that they believe in deeply, to continue caring for our most vulnerable. Nous reconnaissons que le Québec, par exemple,
recognize that Quebec, for example, has taken concrete steps to encourage and compensate those people who work in essential jobs, such as in our seniors' homes, because they are so important at this point in time, and we are in discussion with the provinces to ensure that that can happen across the country.
Some security experts are saying that Canada's intelligence network was not prepared for the pandemic, and that instead of being able to rely on our own Canadian intelligence, we were dependent on our American allies as well as the Five Eyes network. When specifically and exactly did Canadian intelligence tell you about the possibility of a pandemic, and when did you hear that information from our allies?
We had meetings of the incident response group as of late January to talk about the COVID-19 potential threat. We were well coordinated with our Five Eyes allies and other intelligence services around the world, and being aware of this potential challenge on the horizon, and we're dealing with it as of the end of January.
We had meetings with intelligence and security officials in January, and we discussed our concerns at that time about the coronavirus. And this is something that we continue to follow starting then, in concert with our allies in the Five Eyes group and other allies around the globe. Christian Noël, Radio-Canada. You spoke earlier of a gradual return of the economy, a phased-in return. What would that look like in Canada for people? And also at the border with the United States. Now, I understand that people want to know when we're going to be able to return to our normal economic activities that are currently at a standstill. But I must emphasize the fact that we must remain in this phase for some time to come. We are not on the other side of the curve at this point. We're not through this first wave of COVID-19, and therefore we have to stay the course until science and experts tell us that we can start to relax some of those measures. Now, there will be some industries or some economic sectors where people will be able to return to work more safely. And that's the kind of thing we'll be talking about with the provinces in the coming weeks. Now, in terms of the United States, we are still in discussion with the Americans on a coordinated approach, but certainly the travel restrictions will remain in place for many weeks.
We recognize that people are eager to know when we'll get into the next phase and be able to loosen some of the restrictions on work, on school. We will be looking at that very carefully with the provinces in different ways across the country to make sure that where we start work up again in the weeks where we're allowed to do that, because right now we are still very much in this phase and will need to remain in this phase for a good while still. But as we start to open up, we will be strategic and vigilant about what we are able to do in a very gradual way. In regards to the American border, we recognize that travel restrictions are going to remain extremely important in terms of containing the spread of COVID-19 in Canada, and we're going to continue to work with the Americans and people around the world to ensure that we continue with these restrictions.
With respect to the long-term care facilities, you say that you're in conversations with the provinces to see what you can do to help. Now, what's the problem? Is it money? Is it staff? Army intervention? Are those things being discussed? And what can the government do in concrete terms to help them, not just guidelines? Well, there are varied discussions happening with the provinces with respect to these seniors' homes, because the various regions have different circumstances. There are some provinces that are very interested in the Quebec model, which means extra pay for people working in these seniors' homes and long-term care facilities. Some are interested in that, and perhaps the federal government could participate by giving them money to hire people. There are other proposals from other provinces that we're also looking at, but we know that it's very important to be there for our seniors, and as far as I know, there has not been any official request to bring in the Army.
We've been looking at different ways of ensuring that our long-term care facilities and our seniors' residences have the support that they actually need, have the workforce that they need to take care of our seniors. There are a number of provinces looking at the model put forward by Quebec that involves a salary top-up for people working in these essential jobs. We are willing to participate in that, in sending money to the provinces to help in those, and we're having discussions with the provinces about what that is. But there are very different needs and situations right across the country, and we're continuing to work with different provinces on their different priorities.
Prime Minister Tom Perry with the CBC News. Premier Jason Kenney says that federal bureaucracy is standing in the way of approving tests and drugs to use against COVID-19. He's directed his officials to consider using medications that have been approved by Europe or the U.S. Health officials. Health Canada is the regulator of these approvals here in Canada, so what would the consequence of a province attempting to do this be, given it doesn't have that jurisdiction?
We are in an unprecedented crisis, and that creates a significant level of anxiety. So I understand that people can get anxious and impatient about things, but as a government, we are going to remain grounded in science. We are going to remain grounded in our experts who are doing an excellent job in ensuring that Canadians are kept safe and healthy. Okay. Je reconnais que dans une situation
I know that in an unprecedented situation like this, people may be anxious and impatient, but we are going to remain focused on scientific recommendations and the advice of our experts in terms of what we should be doing to help Canadians and keep them healthy and safe.
He also spoke yesterday about Dr. Theresa Tam. And he said he believes she's qualified to be Canada's Chief Public Health Officer, but he also said that in January she was repeating talking points out of the People's Republic of China about there being no evidence of human-to-human transmission. What's your response to that? And do you think comments like this run the risk of undermining the credibility of Canada's public health officials?
I think Canadians have demonstrated that they have a tremendous level of trust and confidence in our public health officials and in our medical system. And we are going to continue to work with top medical officials like Dr. Theresa Tam to make sure that we're doing everything we need to do and have done every step of the way to keep Canadians safe. Les Canadiens ont raison d'avoir confiance.
Canadians are right to have confidence in our public health authorities and our medical experts because they are there to help us and protect us. We will continue to work with all our public health experts to ensure the health and safety of all Canadians, including, of course, the wonderful Dr. Tam.
Merci tout le monde.
We now join the following program in progress.